Welcome to our channel. Today our topic is SRB based teaching wound healing chapter 1 part 4 phases of wound healing, which means the how wound healing is started and how it ends. Let's see the video. See, phases of wound healing. Wound healing is classically divided into four stages. Number 1 is hemostasis, number 2 is inflammation, number 3 is proliferation, number 4 is remodeling. See, at the time of injury, our body trying to stop the bleeding from the wound site by various mechanisms like platelet plug and coagulation cascade, which is called hemostasis. It will occur at the time of injury. Then coming to the inflammation, which will occur within 24 hours to 48 hours after injury. Here, the inflammatory substances like polymorphonucleosides, neutrophils, macrophages will appear, and which will help the antigens or foreign body substances, foreign body which will present at the wound site, which will help the antigens and which will destroy and clean the wound, which is called inflammation. Then proliferation, which will occur after 3 days. Here, the once injuries occur after inflammation, our body mechanism try to regenerate the tissue which we want by angiogenesis and rehabilitation. Here the regeneration of new tissues will occur, that is called proliferation, which will occur 3 to 21 days, which will vary. Then coming to the remodeling stage, here once the proliferation is occur, tissue we will get, and that tissue will get strengthened after some period, which is called remodeling. See, in the first stage, hemostasis, which is clot formation, which is mainly, which has three events. Number one is the blood vessel contracture. After getting injury, the blood vessel will contract because of platelet induced serotonin, which will act on the endothelium of the, here the endothelium of the blood vessels, which will causes the contraction of the blood vessels and increase the permeability of the blood vessels. So the platelet rich substances in the blood vessels will come and contact with the injured site. This is number one. Second, the platelet plug will formation. Here the platelet will come and contact with the injured site, and this will produce the platelet plug. And then this also initiate the intrinsic and extrinsic pathway of coagulation that will produce the fibrin and clot formation. These are all the three events will produce the blood coagulum, which will occlude the further bleeding from the blood vessels, which is called hemostasis. Once the hemostasis is attained, that wound will attract the hemoattractant for the inflammatory process, second stage. See, second is inflammation. After blood clot formation, inflammation started. See, within 6 hours of blood clot formation, polymorphonucleosides, otherwise called neutrophils, will come and contact in the wound site. Once neutrophils enter into the wound site, which will identify the antigen and which will ingest the antigen produced by the foreign material, and which will phagocyte the antigen. Once which will phagocyte the antigen, it will destroy the antigens and degranulation of the antigen will occur. So decontamination done by neutrophils. So, but the neutrophils half life is 24 to 48 hours. After that, macrophages will come and contact with the wound site. Macrophages also did the same decontamination by this process and also initiate the proliferation by macrophages and also initiate the immunity by presenting the antigen to the T cells. See, number 3 is proliferation, which is nothing but the granulation formation. Here the three main cell types are involved. One is epithelial cells, fibroblast and endothelial cells. See, number 1 is fibroblast. Fibroblast will come and contact with the wound site after 3 days. This fibroblast produced by the cytokines, which is activated by platelets initially, then neutrophils, then lymphocytes. This fibroblast number will gradually increase after 3 days, so the macrophages number will reduce after fibroblast number is increasing. So during the macrophages number is high, the wound will be like granulomatous lesion. Once the fibroblast number is increased, that will produce the granulation tissue. The focused form of fibroblast is called myofibroblast. This myofibroblast will pull the tissue's edges towards center, so that epithelial cells and this granulation tissues will come to the center line, so the wound will get granulation because of fibroblast. This fibroblast will disappear after wound healing by apoptosis. Then, because of ruptured tissue, the endothelial cells will come and contact. This endothelial cells will produce neoangiogenesis, new blood vessels formation. These new blood vessels will be highly leakable, so the blood content, the proteinaceous substance will come and contact with the wound site, that also produce granulation with fibroblast. First we see the fibroblast, then endothelial cells. Now the epithelial cells. Epithelial cells means the skin layer, which will formed by basal and suprabasal prickle cell rapidly will go mitosis, then only which will produce the epithelial cells. Epithelial cells start migrating from this edge to this edge, and then which will stop after contact in the midline by contact inhibition. This epithelial seal typically takes place 21 hours to 28 hours. See, stage 4 is maturation. Previously the fibroblast will produce collagen also. Collagen at the end of the 3rd, 4th day, the collagen will get from the fibroblast. Initially the collagen 3 will appear, then which will convert into the collagen 1. See, in the 3rd stage, the granulation tissue will get into the wound. After getting the granulation tissue in the maturation period, the granulation tissue will convert into the fibrous connective tissue. So in the fibrous connective tissue, and the collagen also initially in the vertical line. So after converting into the collagen 1, it will be parallel to the skin surface, so which will get more stronger than the initial wound strength. Here see, the stage 1 is the hemostasis, stage 2 is the inflammatory stage, stage 3 is proliferative stage, stage 4 is maturation phase. See, now we studied phases of wound healing: inflammatory stage, proliferative stage, remodeling stage. The substance or cells involved in the wound healing are fibroblast, neutrophils, macrophages, platelet, erythrocytes, and keratinocytes, or otherwise called epithelial cells. See, we will see next video about wound healing chapter.